not just within the US, but even like different countries are applying different approaches.
Yeah.
Here we are talking to a MD, PhD with experience in infectious diseases who works at freaking Mass General. What's your take? Because I'd rather hear from you than a lot of the talking heads.
Well, I'll say probably unsurprisingly to this gang that's going to be paying attention to this live stream, my take is based on the data and the science behind what's going on. I think you're right. In the beginning, there was a lot of fear, a lot of, in some ways, panic about what was happening. Toilet paper was, right, on short order. You couldn't get bleach wipes, all of those things. And we saw a lot of physicians and scientists really come out in public and talk about what was happening. And I think we did a lot of great things in that first phase, shutting down businesses and schools in an effort to decrease the spread and flatten the curve. It actually worked. In a lot of the states that were really hard hit, the curve actually flattened. We saw less infections. We were able to prevent infections and deaths because we did what we had to do. I think we've entered another phase now. We've entered a phase where we've been in this social distancing setup for 3 months. We are all eager to get outside and to get back, to bring our economy back, to do all the things that we usually do in the summertime. But we have to remember that this infection is still out there. And there are many, many states in this country that are having rising numbers, increasing numbers of infections every single day. We are still seeing people die from this. We are still seeing hospitals overwhelmed from the virus. My state, Massachusetts, I have to say, has done a pretty good job. And we actually are one of the only states that has decreasing numbers day after day. We're doing the hard work of social distancing. We're doing the hard work in the hospitals to get people better and to get people out of our ICUs. But what I worry about is that there are a lot of places in this country that aren't listening to the scientists and aren't paying attention to the data.
So in those scenarios where people they become impatient and maybe they're also saying, hey, people aren't dropping like flies, as far as they can see. What do you think is the worst case scenario for either states or regions where they're pretty much skipping to, the phase 3 or 4 and kind of opening business as usual? What do you think is the risk there?
I think there are a lot of risks. We could have a second wave. We could have a second wave that's larger than our first wave. We could see those that are most vulnerable, those that it's harder for them to do social distancing, those that are essential workers and frontline workers, we could see them overwhelmed by this virus. We saw what happened in New York City, in Seattle, even in my hometown of Boston, when the numbers increased to a level that really overwhelmed the healthcare system. That was in phase 1. If phase 2 or wave 2 is even worse, those cities are not going to be able to handle the number of people that are coming into the hospitals. And we're going to see people suffer. We're going to see people die from this infection, when really all we have to do is listen to the data, listen to the physicians, the scientists, the public health experts who are telling us we have to wear masks, we have to stay at home, we have to do the hard work of distancing ourselves.
So how do you respond to people who say, maybe I work in a job, or my state has many jobs that, they're not these knowledge worker jobs where people can hop on a Zoom and, do their work from their home office. And this is really harming families and hardworking people who need to pay the bills. Yeah. And, and then also like parents who are kind of trying to almost losing their wits with the kids running around and, not being able to go to school and yada, yada. Like, how is your view like, well, that's just, that we all have to suck it up? Or is there some middle ground where people can still take care of their family and be safe and responsible? I
think it's really hard. It's really hard. There are certainly people who, can't work from home. They can't work over Zoom. They can't telecommute, right, in the way that other more fortunate people can. There are businesses that require us to go out into society and to walk into the doors of that business to buy a coffee, to go into the retail shop and buy something that keeps the shop going. And we have to recognize that fact. But I also think this is going to be really hard for all of us. This is going to be a really challenging year for all of us as we try our best to prevent the spread of this virus. And it is incumbent upon our government to help us out, right? And we'll probably talk about this later, but emergency cash payment and emergency cash relief, UBI, right now in this moment is an essential part of our government to make sure that people can continue to exist and thrive and survive, even when they can't leave their house, even when they can't get to that job that doesn't allow them to telecommute. It is our government's job to help us through this crisis.
Yeah, I noticed on your website that one of your priorities is financial security. Yes. And I also noticed that it talked about relief during the crisis, direct cash relief. Was that a explicit choice not to support basic income beyond that, or how did you sort of arrive at your position on universal basic income?
Well, I'll say first that financial security has always been a part of my platform. It's always been something I've thought about, and in particular, I think of financial security as a key component of healthcare. You can't be healthy if you're not financially secure. You can't have prescriptions, you can't go to the doctor, you can't do all the things you have to do if you're not financially secure. So it's something we've been talking about since day one of the campaign. But I'll be honest and say, basic income was not something that I was talking about at the beginning of the campaign. And COVID happened, and like it did for so many people in this country, it changed my perspective. It changed my understanding of how important income is and basic income is. It changed the way that I thought about policy. And it allowed me to begin to think about what is the role of basic income in our society. I think right now we have to deal with the emergency direct cash payments that are necessary in the setting of COVID. We've got to get that through. And I actually think there's the political will to get that through during the time of this public health crisis. I think we have enough people in Washington on the right and on the left who agree that we've got to help people through. And so I have thrown my support fully behind the legislation that Senator Harris and Senator Markey have put forward to talk about $2,000 a month for every citizen in this country. And I think once we get that through, then we can move on to talk about, okay, how do we make basic income a part of the national conversation going forward, right? Let's get it passed so that money can get into people's pockets right now. And let's utilize, in some ways, the political support that we have because we're living through a crisis to get it through. And then let's make it a long-term reality once we get there.
What was it like talking to Humanity Forward and I guess any conversations with Andrew when you were being considered for the endorsement? I'm curious what that process was like and how it went down.
Well, I have to say, I love the Yang Yang. They've been amazing to sort of work with both at the local level, and the Massachusetts Yang Yang has been a tremendous support for this campaign, but at the federal level as well, and Humanity Forward. I'll say a few things about the interactions. One, they're really smart and they love data and science, and it really is helpful because it's what I like to talk about. Two, they're super efficient, and Humanity Forward allowed me to have a direct conversation with them about what I stand for, what my platform is, why I'm in this fight. And so that was really helpful. It didn't feel like I was going through multiple layers. And then, so the third thing is that I was able to directly have a conversation with Andrew. And he's an amazing, amazing man who was incredibly generous with his time and with his knowledge. He really helped me craft my message in a better way. He allowed me to ask him questions, present scenarios to him and get his feedback and his opinion. I could not have asked for a better experience as I was going through the endorsement process. And I think they, it's been a two-way street. I've been able to ask them questions. They've been able to ask me questions. I've taught them. They've taught me. We're working hand in hand to try to move this campaign forward.
That's great to hear. And I'm glad that you had a good experience and you're getting help from the Massachusetts Yang Gang. They're legit.
Yes, they are.
I'm curious, Robbie, how did you decide to run? I mean, you're a PhD, MD, you're working at Mass General. Like you've kind of, accomplished a lot and you're in a great spot. You're married, you've got it all done. Why in God's name would you put yourself out there
to join
that mess in TC?
This is actually something I talked to Andrew about, right? Because he also came from sort of not being in government to going into the government space. And I'll say a few things. One, I'll say I actually think that medicine and government are a lot more similar than people believe them to be. At their core, both are about helping people. Both are about making sure people live a healthy life. And so I don't feel like I'm going into something totally different. The other thing I'll say is that being a physician, being a primary care doc in many ways, allows me this opportunity to talk to people one-on-one every single day and hear how challenging life is. And I think I would challenge you to find any primary care doc in this country who does not say to you, we've got to fix the system. The system is rigged against so many people. We've got to get out there and fix it. And I heard it over and over and over again. I heard it from my patients that are living with HIV. I heard it from my patients that are fighting the system in the substance use space. I certainly heard it from my patients in the transgender health program, how hard it is to just live and exist and have that healthy life with the current setup. And there wasn't a light bulb moment. It wasn't like all of a sudden, oh, I'm going to run for Congress. It was conversation after conversation, building upon itself, making me realize it's time for somebody with a healthcare perspective to get into this race. It's time for us to have the right voice in Washington so that we can fix the system for everyone.
Let's talk a little bit about the healthcare system. I mean, I feel like every 4 years we have this debate and, one side says, well, we need single payer. The other side says we just need to, allow interstate competition, maybe health savings accounts, that kind of thing. What if you had to try and summarize for people what you think are the key problems with the American healthcare system? We'll go to solutions in a minute, but what ails us now? Because on the one hand, we do have some of the most advanced healthcare capabilities and research in the world. Mm-hmm. We're the envy of many countries in terms of our medical schools and our, research programs and pharmaceutical companies. So what do you think what's the biggest problems that we're encountering now? What are the causes of those problems?
I think there are three problems facing the healthcare system. One is access. We don't cover every person in this country. We don't provide coverage for every person in this country. We don't treat healthcare as a human right. We treat it as a commodity that we can trade and buy and sell. The number two problem is cost. Year after year after year, we are paying more and more and more for our healthcare. Yes, we have the best medical schools in the country or in the world. Yes, we have, we are the envy of the world when it comes to pharmaceutical development and innovation and all of those things you're talking about. But we are paying more and more and more each year for it. And I think the third problem is that we have always siloed healthcare to itself and said healthcare is about access and the price we pay in pharmaceuticals, and it's all really confined in this space, right? But really, healthcare is so much bigger than that. Housing is healthcare. If you don't have a safe house to go home to, there's no way that you can be healthy. Financial security is healthcare. If you don't have the money to pay for your prescriptions and pay for the doctor's visit, you're not going to be healthy. Transportation is healthcare. Right? We've got to start thinking about healthcare in this broader sense. So I think until we address access, and cost and expand our view, we're never going to move ourselves in the right direction in healthcare.
So what would you propose we do? Those I think a lot of people would agree that those are all problems that we've all observed in our day-to-day life, access, cost, and sort of like the total health of a person. What can be done in DC to get us closer to a better outcome?
Well, I want to go back to something you said, which is that I actually don't think there are two sides to this issue. You would think that it would be Republicans saying, let's do the health savings plans and let's think about interstate commerce, and Democrats would all say that we should move towards a single payer system. But there are all many different views in this argument. And in fact, the person I'm running against is a Democrat, and he voted against the Affordable Care Act. He voted against healthcare expansion in the way that we believe that Democrats would fight for healthcare expansion. So I think the first thing is we've got to make sure that our side does argue for and push for the right policies and what we all believe is the right way to move forward. What is that way? I think that's a move towards a single payer healthcare system. And I believe that because a single payer system allows us to address two of the three things that I talked about. It allows us to provide access to everyone in this country. It can be mandated and it can be spread out across every state if it's all with one insurance company, right? One government-run insurance company. And it allows us to control cost. When we have only one person or one company, one entity controlling the access and controlling the negotiation of drug prices and reimbursement, we can begin to put in the cost-saving mechanisms that we need to flatten the curve of healthcare expenditures, or maybe even reverse the curve of healthcare expenditures and get the cost to decrease year after year.
So let me play devil's advocate, because I have many Republicans in my family, and until 2008, I was consistently voting Republican. One of the arguments I've heard to what you're proposing is, oh, look at Canada. People have to wait 3 years to see their doctor. It's rationed. And then the second argument I've heard is, well, if the government is going to force private enterprise to accept certain low costs, the quality will go down, innovation will go down, new research and development will be, reduced. Any thoughts on those criticisms?
Lots of thoughts. I'll first say that, people oftentimes compare an American single payer system to Canada or the UK. Mm-hmm. And fundamentally, we are a different system. We will be a different system. We are a very different country. Those are countries that have relied on a public insurance plan and public hospitals to provide care all across the country. That's not what's going to happen here. We are going to have private hospitals, private healthcare institutions, and public hospitals and public healthcare institutions. They're just all going to accept the same insurance plan. So we're not saying that, if you want to come to Mass General, you've got to wait in a line, or you're going to be pushed over to this hospital that may be closer to your home. You're still going to have the choice of where you want to go, the doctor you want to see, the system that you want to be a part of. But you're going to be guaranteed coverage no matter where you go. Now, it's going to have the benefit of saying that if you live in rural America and there's a hospital right there, that hospital is going to get reimbursed for the care that it provides you, and you can go to that hospital. Instead of what's happening right now, which is that rural hospital isn't getting reimbursed for your care, and that rural hospital is closing, and rural hospitals all across this country are shutting down, and people are now without health care. So it is going to allow us to build a system off of our public and private institutions, but just expand coverage, universalize coverage. So that's my first statement to the sort of Canada, UK example, and I hear about it a lot. I think the second thing is that arguing that we're gonna tamp down innovation, we're gonna change the overall American idea of pushing for innovation, constantly pushing for higher quality, pushing for a better system. I think that's fundamentally opposed to what we are as Americans. I think we're always going to fight for a better system. We're always going to fight for the better treatment. But we right now actually don't have the ability to innovate because the costs are being dictated by somebody else. The costs are out of control. When we put a cap on the cost, it will now all of a sudden create a system where healthcare institutions have to innovate. They have to change how they deliver care. They're going to have to do it in a cost-effective manner. They're going to have to do it in a way that provides better care at a higher value without increasing the cost year after year. So we're actually going to drive a lot of innovation, a lot of discovery. We're going to force people to think hard about how we deliver healthcare in this country and how we do it in the best possible way at the lowest cost. And I think that's part of America, right? That's the American idea of, every year we're going to innovate and we're going to try to drive down the cost. That's our system that we have here. And I don't think that's going to change just because we move to a single payer healthcare system.
Why do you think the country is so divided on this? I mean, I've had debates with, my Republican friends, and it's almost accepted as a fact that Obamacare was just a complete disaster. And thank God Trump rolled back some of the ACA provisions. And I wonder, even if you get there, you're going to have to work with folks on the other side of the aisle who might be reasonable, but have constituents who are just kind of, really dogmatic, that they don't like socialism or anything that even looks like socialism, or anything that looks like Obamacare or ACA. And it seems like we're stuck. Do you have any thoughts on how you avoid being, one of these well-intentioned, super smart people that go to DC and then kind of either get sucked into the system or throw up their hands and say, whatever, I gave it my shot. Yeah. How would you try and, help us do something that we haven't done as a country for a while?
I think some of it is language, which sounds like a weird thing to respond to that question with, but I actually think, there was all those studies, remember, about how many people hated the Affordable Care Act versus how many people hated Obamacare. And it's all about the language that we use, right? If you say, do you want to make sure that your kid up to the age of 26 can remain on your health insurance? People say, of course I do. And if you say, do you support the Obamacare rule that would allow people to expand coverage? People say, I disagree with that. There's a language component here. And I think we've got to get better on the single payer side and on the Affordable Care Act side. We've got to get better about how we use language. I also think that we've got to start sort of flipping the argument a little bit. One of the things that I hear from people who are more conservative, Republicans that are in this district, people who don't agree with my position on a single payer system, is we can't afford it as a country. We can't afford to make this massive change. We can't afford to spend that much money on healthcare. And my answer to them is always, we actually can't afford not to. We have to start talking about how much money are we going to save if we move to a single payer system. And if there's one thing that Republicans like, it's to save money. Well, theoretically, that's the ideal of the conservative side, to save money, to decrease taxes. Let's show them how we can actually do that by moving to a single payer system. We can actually lower the overall cost of healthcare, and we can begin to decrease the expenditures that we are putting out there every single year. I think we've just got to be smarter. We've got to be smarter about the way we describe this, the words we use, and the arguments we use to bring people onto our side.
Do you think there's a way to move in that direction gradually? I think one of the things that people are worried about is it's such a big, complicated system today that if we changed it, tomorrow, the nightmare scenario that, other people paint sometimes is like, well, you'll wake up tomorrow and your healthcare will be gone and you'll just get some phone number with a constant busy signal. And so people get really worried, like that it would be a big change. How do you kind of ease people into it?
I have to say, I actually think the the biggest issue I took with the presidential primary, the Democratic presidential primary this year, was that it created this false choice for people. That it was either in January 2021, we were going to have a single payer system, or January 2021, we were going to double down on the Affordable Care Act. And that's actually not what the plans were. If you look at Andrew's plan and you look at Joe Biden's plan, and you look at Elizabeth Warren's plan and Bernie Sanders' plan, all of the plans were moving us in the same direction, and that's to universal health care. All of them would eventually get us to a single payer system. And actually, all of them came up with the same steps to get us from where we are now to where we have to go. Expanding Medicaid in all 50 states, lowering the age to get onto Medicare, right? Making it easier to provide coverage to more people across this country, and then putting in realistic benchmarks. I think those should be financial or economic benchmarks that allow us to know when we're ready to move to the next step of universalizing our coverage, the next step of moving towards a single payer system. I don't think that this is going to happen in one day. I don't think it's going to happen in 1 month. And I actually don't think it's going to happen in 1 year. I think we've got to look at this as a long-term plan about how we shift from where we are to where we have to go. And in some ways, capitalize on each step, show to the opposition the benefits of each step, both financial and in the healthcare space, expanding coverage.
Are you worried at all about not just the conservative voters and congressional representatives, but the industry kind of incumbents? I mean, it's a very big business, and there are players that make a lot of money in this industry who may not want a single payer system. They may actually prefer the current approach.